Hey everybody, how's it going? Thank you so much for joining our webinar today. My name is Lori Marie Peixoto, and I'm the Director of Strategic Partnerships and Education here at NeedyMeds. Thanks for joining our webinar today, and today is a special webinar because it's my last webinar at NeedyMeds. I'm moving on to another opportunity, and my colleagues Maxwell Green and Carla Della Porta will be taking over the webinar program. Many of you have difficulty paying for your healthcare expenses, or perhaps you are here to learn how to help your patients or clients find help. So today I'll teach you how to find patient assistance resources on the NeedyMeds website, and I also hope to give you a few tips about how to apply to these programs. So just a few housekeeping points before we begin. If you have any questions, please feel free to type them in to the questions bar of your control panel at any time, and I'll answer all questions at the end of the presentation. This webinar will be recorded, and you can find it on our webinar library page, which is under the Getting Started tab on our website. And lastly, I'll provide my contact information at the end should you have any follow-up questions that we don't get to, or if you'd like a copy of this presentation. So with that, let's begin. So who is NeedyMeds? Here is our homepage. NeedyMeds is a national nonprofit organization, and we were founded in the mid-90s by a retired physician and a medical social worker. And they discovered patient assistance programs, and they thought every patient and every prescriber should know about them. So since it was the mid-90s and the internet was becoming a major source of information for people, they decided to create a website. So that's what we are. We are an informational resource. And through our website and our toll-free helpline, we connect patients to programs that provide financial assistance for healthcare expenses, including but not limited to medications. So we don't offer financial assistance directly to patients, but we refer patients to programs that do. And we're very proud to boast that about 1.3 million people use our website every year. And that includes patients and their family members, healthcare professionals, social workers, patient advocates, and community healthcare workers. So our website began with just a handful of patient assistance programs, but today we have over 7,000 points of savings on our website, ranging from programs that provide free medications, to coupons, to discounted imaging services, and much more. All the information is available online at no cost and without registration, so you can remain completely anonymous as you search our website for your medicines. You'll find all the financial assistance programs for patients under the Patient Savings tab on our website, and I'll show that to you in just a second. But you always want to start looking for patient assistance, prescription assistance programs, because those will provide free or deeply discounted medications and therefore the greatest dollar amount of savings to patients. So what are PAPs? PAPs are prescription assistance programs. They're sponsored by the pharmaceutical manufacturers, and they'll give free or discounted prescription medicines to people that qualify. There's no law requiring a pharmaceutical company to do this. Each company does this to be a good corporate citizen, and they can do whatever they want in terms of eligibility requirements and the application process and so on. So every program is unique, and not every medication will have a PAP. Eligibility requirements and applications will vary from program to program, as I mentioned. Some of these programs will help people who are uninsured, while others will help people that have insurance but maybe do not have drug coverage, and still others will help people who have drug coverage but perhaps cannot afford their co-payments. So it really varies from program to program. The one common generalization you can make about these PAPs is that the patient's healthcare professional needs to be involved in the application process. And that means they must provide a valid prescription for the medication, and they also need to sign the application. So where might one learn more information about PAPs? Well, that's where NeedyMeds comes in. And with that, let's begin a tour of the website. So here's our home page. I'll make the screen larger. As I mentioned, there are two ways you can search for PAPs. One is to simply type the name of the drug in this drug search box and click here, and that will pull up all PAPs for that medicine. And the other way is to go to the Patient Savings tab, which is where all of the financial assistance resources are located. This is one-stop shopping, or so we hope. So over here in the left-hand column, you'll see prescription assistance programs. You can search for a brand name drug, a generic name drug, or if you already know the name of the program or the pharmaceutical manufacturer, you can search by those as well. And program applications is a list of all of the current applications. If you use the same ones all the time in your practice, you can save links to them as well. But let's say you wanted to search for a brand name drug like Abilify. I click on brand name drugs. These blue icons just give you more information. But scrolling down, I click on Abilify. Let's say I'm interested in the tablet. The picture of the capsules is the PAP, and this other blue icon is for a Consumer Reports article about psychotropic medications, and it references Abilify, and that may be helpful to you or your patient or client. But for the actual application, I'm going to click on the tablets. This particular PAP is sponsored by Bristol Myers Squibb Patient Assistance Foundation. Sometimes there'll be more than one patient assistance program for a medication, and if that's the case, we'll put the programs that provide the greatest dollar amount of assistance at the top of the list and programs that provide lesser assistance toward the bottom of the list. But for the Abilify tablets, there's just one PAP and this is it. So here's the contact information for Bristol Myers Squibb. If you or your patients have any questions about the application, please direct them to Bristol Myers Squibb rather than NeedyMeds. Think of NeedyMeds as the yellow pages, and we'll connect you to the PAPs. But if you have a particular concern or question about a PAP, you want to contact that company directly. And so here's their contact information, including a link to their website. Scrolling down, the section underneath that is where you'll find an active PDF link to the PAP application. And if you click on this link, you can complete the application online, print it out, and get it ready for your prescriber's signature. The medication section will clarify what medications are covered under this particular program. The eligibility requirements are perhaps the most important section that you have to pay attention to. This will tell you who's eligible for the program. In this particular case, Bristol Myers Squibb will help people who have no prescription coverage and who live at or below 250% of the FPL. So if you want to know what it means in dollars and cents to be at or below 250% of the FPL, you can click on the FPL income calculator, and let's say I had a family of 3 that had a yearly income of $48,000. They're at 238% of the federal poverty level. But let's say they made less money. Or let's say they made a little more money. Let's say $58,000. It'll calculate and will tell you that it's 288% of the federal poverty level. So perhaps this family is not eligible for this particular program, but I'll show you other places on the website where they may be eligible. As I said, Bristol Myers Squibb wants to help people who are at or below 250%. And if you do your calculations and it shows you that you're between 250 and 260 or 65%, which is just slightly over their limit, we would recommend that you make a phone call to the program and explain your situation to them, or maybe it's your patient's situation, and ask the company to make an economic hardship exception for you or for your patient. There is some subjectivity involved in these applications, and the representatives who answer the phones do have some discretion when it comes to the approval of applications. So don't feel shy about asking for an economic hardship exception. They do make exceptions on a fairly regular basis. Also, if you complete an application and your application is denied, appeal. Go to the company's website and find out what the appeal process is. It's usually filling out a form or perhaps writing a brief letter, but definitely exercise your right to an appeal because we've been told from pharmaceutical insiders that they really don't like to say no to people who appeal. They really do want to say yes to people. They do want to help people. And so if you take the time and effort to appeal, it will often work in your favor. Also, as I mentioned, not every drug has a PAP. So if there's no PAP for the medication you need, call the drug company that manufactures the medicine and ask them for an economic hardship exception. Try to bargain with them. Actually say, you know, I can't afford the cash price of this. Can you help me out? What's the lowest cash price you can offer me for this medication? And they may be willing to work with you or maybe even give you some free samples if nothing else. So it pays to be an advocate for yourself or for your patient, to be assertive and maybe even a little bit pushy. And if you can, you know, get out of your comfort zone and get comfortable being assertive, it may pay off in the end and may save you a lot of money. And again, if you or your patient have an income level that's, I would say, 10 or 15 percentage points over the FPL, definitely pick up the phone and ask for an exception. The next section is we'll tell you about how to obtain the application and how to return it and what the decision time frame turnaround is. In this case, they say within a week. And I would say, just to be on the safe side, always estimate that it'll take, you know, maybe 3 or 4 weeks from the time you apply to a program to the time you get a decision, and then they mail the drugs and the time you receive the drugs. So give yourself about a month for that whole process to occur, just to be safe so that you don't run out of your current prescription while you're taking care of this application. Underneath that, it will tell you where the medication will be sent to, which is usually the patient's home or the doctor's office. You also want to note for yourself or for your patient or client when you have to reapply to this program. It's usually 6 months or maybe once a year, so you want to note that on your calendar as well. So that's a PAP application for a brand name drug. You could have also searched for a generic name drug as well. It's a myth that all generic medications are inexpensive. Some generic medications are quite expensive if you had to pay the cash price for them. So if you ever find yourself in a situation where you have to pay the cash price, we've compiled a directory of generic discount drug programs all over the country. So let's say you live in the state of Georgia, for example. There are 21 discount drug programs in the state of Georgia. They're alphabetized by the name of the retailer, ranging from CVS to Kmart to Publix and Rite Aid. This is another resource we hope is helpful to you. Most of these generic medications are between $4 and $15 for a 30 or 90-day supply. And you'll click on the link to the retailer and it will give you more details about how to apply to that program. And again, I found that right here under prescription assistance, and it's called $4 generic discount drug programs. Some of these applications, you may be tempted, you know, if you're a social worker or healthcare professional and you help a lot of patients, and maybe you go to the same applications over and over, you may be tempted to print out paper copies of these applications and keep them in a file. We would advise against that because these programs change all the time. Programs close, new programs open, their eligibility requirements change, FPL qualifications change, and so on. So every time you apply for your patients or yourself, you want to go to the website and get a fresh application off the website each time you apply. Again, do not print out stacks of applications and let them hang around for a while. But as I was about to say, some of these applications can be complicated and intimidating. And if you or your patient or client have trouble filling out these applications, refer them to this section called Help with Prescription Assistance Applications. Let's say you live in the state of Louisiana. In the state of Louisiana, there are currently 6 programs that we know about. So again, this is not a comprehensive list, but there are 6 programs that will help people apply to these PAPs in person. Most of these are nonprofits. Most of them will do it for free as a community service, and some of them may ask for a small fee or a small donation. But you'll see here a directory of programs in your state that will help people apply to these programs. And if you know of any programs not listed in your state, please let us know. And you can send a link here to NeedyMeds and let us know of any programs that we don't have listed. This is a work in progress. Underneath that section, you'll see we have a directory of free and low-cost medical and dental clinics. We've got about 14,000 clinics across the country. It's really nice because sometimes people have medical insurance, but they don't have dental insurance. And so if you or your patients find yourself in that situation, click on our dental clinics directory and see if there's a place where you can get free or reduced fee care, preventive care or treatment for your dental health. And medical clinics will include women's health centers and clinics that will do STD testing. And for example, if you live in the state of, let's say, Massachusetts, there are 258 free or low-cost clinics for people. And we will give you a link to the map, the address, the website. We'll tell you who can be seen at the clinic, and we'll tell you if there are any fees or what languages are spoken. We'll also tell you the services that are provided and the hours and so on. And you can click here and print out a link to these clinics for your patients or your clients if you want to refer them to any of these clinics. Underneath that, we have a directory of radiology imaging centers. This is a new database. It's not yet complete. We're adding to it every day. We've got a team working on this database. But we're starting to put together a database of imaging centers that do MRIs and CAT scans across the country. And you'll be able to see all the centers in your state, and hopefully we're trying to make it as informative and helpful as possible. So when we have the information, we're posting the cash prices for their services and if they offer any payment plans or if they offer discounts or sliding scale fees and so on. So this is a work in progress, and if you know of any imaging centers you'd like to include in this database, please let us know. Underneath that, we have a directory of coupons and rebates. This is very convenient. You can look for prescription medicines or over-the-counter medicines and supplies. You can search for a particular product by its name, or you can search on category. And this is neat because if you, for example, have diabetes or you have patients or clients with diabetes, click on diabetes, scroll down, and you'll see a list of coupons for things like testing strips and glucose monitors and so on. Usually the links will take you to the manufacturer's website, and you might get a free sample or a mail-in rebate form or maybe a discount or something like that. So that's another resource that we hope helps to fill in the gaps in people's healthcare coverage. So maybe if you don't qualify for a PAP, maybe you appear to have an income that's too high for the program, or maybe you don't have U.S. citizenship, or maybe you don't have you have more medical insurance than they are willing to cover. Definitely check out coupons and rebates because you might find assistance there as well. Another important section of our website where you'll also find great financial savings would be the diagnosis-based assistance section, which is here in the middle. If you click on search by diagnosis, for example, if you or your patients were looking for resources to help people living with cancer, you click on cancer, and you'll see there are 153 diagnosis-based assistance programs for cancer. And we've arranged them by programs that provide national services, and then underneath national services, they're alphabetized by state, as you can see. And so what's interesting about the diagnosis-based assistance section is that this is for things more often other than medications. You might find a few medications or copay cards in this section, but by and large, this is where you're going to find financial assistance for costs like travel expenses, supplies, durable medical equipment, testing, wigs for chemotherapy patients, house cleaning services, and assistive technology. So this is another great resource, and we encourage you to use this as well. Probably the second greatest source of savings will be found in this section, the first, of course, being your PAPs. Underneath that, you'll see we have a directory of camps and retreats and also scholarships. And you can search by a diagnosis, or you can search by the location of the camp, and so on. So if you have a child with ADHD, you could look up their diagnosis, and you could see that there are currently 74 camps for ADHD, and we'll tell you where they accept campers from and where the camp is located, and we'll give you a link to the program so that you can apply. We also have a section for government programs over here on the right-hand column. These are government-sponsored programs, either sponsored at the federal level, state level, county, or local levels. We've cross-posted this section with the diagnosis-based assistance section. So for example, there is a federally funded program that will provide free breast cancer screenings to women that qualify. So you'll find that in the government section as well as in the breast cancer section if you search for diagnosis and then search for breast cancer. So you won't miss it if you search in one place but not the other. We've recently added to the government program section all of the Medicare counseling or SHIP sites. We've added the PACE sites. About half the states in the country have a PACE site, and PACE is Program of All-Inclusive Care for the Elderly. It helps people meet their health care needs so that they can stay in their homes as opposed to having to live in a nursing home. We've also added, as I said, all the assistive technology programs that are funded by the federal government. And for your convenience, we've put a link to the federal poverty guidelines and a tax return request form. There are a few other resources you may want to check out on the website as well. HealFunder is a crowdfunding platform that we've created. It's like Kickstarter or Indiegogo, except that it's exclusively for medical bills, either medical bills that have already been incurred or something that a patient is saving up for. It can be something medically necessary, or it could be a cosmetic procedure, or it can be something like orthodontia for one's children. Organizations can use this platform for their fundraisers as well. What's unique about HealFunder is that we verify the diagnosis, and we also verify that the funds raised are actually paying the bills that they say they're paying. And so we hope to reduce or eliminate the chances of fraud. Underneath that, we have a directory of discounted MRI and CAT scan services. This is a company that we've partnered with. They offered a discount off the cash price of imaging centers across the country. If you're interested in learning out which centers participate, you can click here or call this 888 number right here. We've partnered with a company that offers medical bill mediation service. They do this for a $200 fee. If you have $1,000 or more in unpaid medical bills, this company may be of interest to you. $200 is a lot of money. On the other hand, if you have a stay in the hospital or a trip to the emergency room when you don't have health insurance and your bill is thousands of dollars, it may be worth a $200 investment to see if this company can speak on your behalf and work with the medical providers to lower your bills. Also, I'll just point out that if you ever do find yourself in a situation where you don't have health insurance, and you have to go to the hospital or you have to go to the ER, tell them up front that you don't have health insurance and let them know that you need a patient advocate. And they will assign you a patient advocate who will hopefully help reduce your bills for your stay in the hospital or in the emergency room. It's always best to be upfront with them from the beginning, and hopefully they'll give you a patient advocate or someone that can help you negotiate down these bills, or maybe forgive them altogether. And that's possible as well. Okay, so now I want to talk to you about the NeedyMeds drug discount card, which is the last-ditch effort to save money on your healthcare expenses. And I say last-ditch effort because, as I said, the greatest financial savings you'll find will be the PAPs and the DBAs. But here is the drug discount card. It's free, and consumers can save between 0, meaning not everything is discounted, and 80% off the cash price of a prescription, an over-the-counter medicine or supply if it's written as a prescription, like aspirin, and pet prescriptions if you buy them at the People Pharmacy. It only works for brick-and-mortar pharmacies. It does not work for online purchases. And last month, we saved consumers about $4 million. The card is used about 80 to 85% of the time it's presented to the pharmacist. So that's how we know people are saving money and that the card is doing what we hope it will do. How does it work? Pharmacies negotiate discounted prices with an adjudicator. And in our case, the fabulous adjudicator with whom we work is called Argus. The discounts change frequently. They vary from month to month and from pharmacy to pharmacy. So we always say to try the card every time you make a purchase. There are no eligibility requirements. There's no registration. There's no activation of the card. It's good to go as soon as you get it. And there's no application. And there are a lot of drug discount cards on the market. So you may be wondering what's different about the NeedyMeds card. Well, first of all, our card is always free to obtain and use. Second, we do not collect any identifiable information about our users. So it's totally anonymous, and we're not selling your information to third-party marketing companies. We only track the dollar amount of savings and the number of times the card is used. And third, although we earn a small transaction fee each time the card is used, we don't try to maximize our own profit because we are a nonprofit, and we're doing this to help patients. And that means that we pass on the greatest savings to our patients. So the small transaction fee that we earn will help us with the administration of the card and also our toll-free helpline. And the card will never expire. You can share one card with your whole family. All you have to do is you bring your card and your prescription to the pharmacy. It's accepted at about 63,000 pharmacies across the country, and that includes all the major chains as well as a lot of the smaller chains too now. And if you ever have trouble using the card, or if the pharmacist doesn't know if they take the card or they tell you they don't take the card, you can call the number on the back of the card, and an operator will clarify the information to the pharmacist or to you. So who can use the drug discount card? Anyone. Literally anyone can use this card. And this is why we offer it, because it fills a gap. So where someone might not be eligible for a PAP, maybe because of their income or their insurance, or where someone maybe is not a citizen of the U.S., anyone can use the drug discount card because you're basically paying cash and getting a discount off the cash price. The only rule, however, is that you cannot combine the drug discount card with your health insurance. Whether it's public insurance like VA benefits, Medicare, Medicaid, or private insurance, you cannot combine the drug discount card with your health insurance. So if you're uninsured, go ahead and use the card anytime you make a purchase. And if you have insurance, then you would use the card instead of your insurance. And you might want to do that, for example, if your medication's not covered, or if the copayment is too high, if you're in a coverage gap like the Medicare Part D donut hole, or if you've exceeded a cap for drug coverage. So if you do find yourself in the Medicare Part D donut hole, just be aware that using the drug discount card will not count toward getting you out of that donut hole, because using the drug discount card, in essence, is paying cash but getting a discount. So it's not going through your insurance at all. So just keep that in mind. So how do you get your NeedyMeds drug discount card? Well, going back to the website, you can either go to the Patient Savings tab and click here, or you can go to the home page and click here where the red arrow is. And this will take you to the drug discount card page. You can print out a downloadable PDF. The paper copy of the card is just as good as the plastic. You could also fill out this online form and request a card, a plastic card, and you can choose one of 4 designs for your plastic card. You can also mail us a self-addressed stamped envelope. Now here's a tool I want to point out to you, which is pretty handy. If you want to see where your card is accepted, what pharmacies participate and accept our card, use this pharmacy search. So for example, if you wanted to see in Massachusetts, all the pharmacies that take it in Gloucester, Massachusetts, where NeedyMeds is based. Oh, there are no pharmacies that take it in that zip code. Let's try Beverly. So in Beverly, Massachusetts, there are 7 pharmacies that take it, and any pharmacy listed in this directory is legally contracted to accept our card. And maybe a pharmacist doesn't know that. Maybe they're new. Maybe they've never seen the drug discount card before. But as I said, if they're listed in this directory, they have to take the card. And there's a toll-free number on the back of the drug discount card where you can call. And you can either call Argus, the adjudicator, or you can call NeedyMeds. But either way, one of the 2 will tell the pharmacist that they have to take the card, and we'll explain it to them. There are other tools as well. Right here, you'll see a drug pricing calculator. This will take you to Argus's website. Argus, again, is the adjudicator that helps negotiate discounts with the pharmacies. So if you click here, it'll take you to Argus's website. And it's a little slow to load, I apologize. But basically, you're going to be able to select the medication you want a discount on to see if it's discounted. And you can select up to 5 pharmacies in your area. And you'll put in the day's supply of the medication. And then it'll generate a table with all the information about the discount that you would receive using the drug discount card. And that estimated price is good for that day only, because the discounts change so frequently. So I'm sorry that this is a little bit slow to load. I'm not sure if it's going to load today. Maybe they're working on the website. Oh, here we go. So you put in the name of your medication. You select up to 5 pharmacies in your zip code. You put in the quantity or the day's supply. You click price, and over here it will generate a table and will give you an estimate of what you would pay on that day using the NeedyMeds drug discount card. Again, I found that by going to this drug pricing calculator. We have a smartphone app of our drug discount card, which you can download to your phone. If you are an organization or a city, town, a state agency, if you're a hospital or clinic and you would like a free supply of drug discount cards, we'd be happy to mail you as many as you need. They're always free, and we can even customize them for you with your organization's name and logo on them. And there's no charge for customizing the cards if we print them in black and white. And if you're interested, I'll give you contact information at the end where you can email my coworker, and she'll give you information about designing a customized card. And again, it's always free. So now I just want to spend a couple of minutes. If you're an advocate or a healthcare professional, check out our Advocates tab if you have a second. This is where you're going to find links to order print materials. We have a Patient Assistance Program Update Service, or PAPs as we call it, which is a free email service where you'll be notified when changes have been made to PAP programs on our website. A similar alert service is called DAPIS, and this is for the diagnosis-based assistance programs. So we'll tell you when programs have changed or opened or closed. You can sign up for that free service. You can sign up for webinars here. Maybe you're interested in the Patient Assistance Resource Education course, which is very similar to the webinar that I'm doing for you now, except that it's targeting healthcare professionals and advocates, and those who pass the exam at the end receive a certificate of completion for their portfolio, so it's like a professional development tool. Patient Assistance Newsletter is for patients or professionals, and it's a monthly newsletter that you can sign up for. I try to put in helpful and practical resources and tips. So these are some things that you might want to check out. Also, if you are a member of an organization, I'd be happy to do a private webinar training similar to this one for your staff. We can set that up at your convenience, and I can record the webinar and send it to you so that you'll always have it for future staff trainings. So if you're interested in a private webinar, you can email me after this presentation as well. The last tool that we have for advocates is, here we go, advocates, is PAP Tracker, which is a software program that we've co-designed. This is for organizations and healthcare facilities that help a lot of patients apply to PAPs. It streamlines the application process. Instead of doing, for example, you have one patient who needs 5 different medicines. Instead of doing those 5 applications by hand, you put the patient's information into the software once, and then it automatically generates the applications for each of those programs. And you can also generate reports for your funders. It reminds you of when you have deadlines approaching and when it's time to do your renewals and so on. So that's something you may want to check out as well. Let me go back to the PowerPoint. So if you are an organization or a healthcare facility or a city, state, we would love to partner with you if you have a passion for helping patients. As I said, we can do customized drug discount cards, we can do webinars, we can collaborate on disease information pages if your organization has expertise in a particular disease or condition. We can help you establish or manage a PAP program or a copay card if you have the funding and inclination to do that. If you're a like-minded organization, we'd be interested in cross-posting each other as resources on websites. So if you want to have a link to NeedyMeds on your website for your constituents, we'd be happy to help you with that. If you have interesting articles that you'd like to submit to our patient assistance newsletter, we'd be interested in having fresh voices. Or if you'd like NeedyMeds to submit information to your newsletters or posting on your social media, we'd be happy to discuss that with you as well. I'll also tell you that we have something called the Volunteer Project for organizations or healthcare facilities, which is a manual and free technical support to help you train volunteers to help your patients or clients find assistance using the NeedyMeds website. So again, it's a manual and technical support to help people, to help your volunteers do this kind of work for people. If you're an individual and you like what NeedyMeds is doing and you want to help spread the word about NeedyMeds in your community, please consider being a volunteer ambassador. We'd be grateful for your time. An ambassador might give out brochures at a community health fair, or maybe give a little talk at your church or your library or your synagogue. Or maybe it would mean tabling at a conference for us. And if you're interested in learning more about that, you can feel free to email me or email outreach@NeedyMeds after the presentation. So here's my contact information if you have any other questions. My email address is lori@needymeds.org. If you want to order drug discount cards or NeedyMeds brochures, please email my coworker, deb@needymeds.org, and you can let her know that you learned about it from the webinar. If you are a patient or you're helping a patient who needs assistance using the website, or maybe they don't have a computer or internet service, please refer them to our toll-free helpline. We have English and Spanish-speaking operators who are available to help people look for programs. They're there Monday through Friday, 9 to 5 Eastern Time. And so that concludes my presentation, and I think right now I'd like to take some questions. Do we have any questions out there? Feel free to type them into your questions bar of your control panel. Any questions? Okay, so if there are no questions, then I want to thank everyone for your time today. Our website is a work in progress, and we value your feedback and suggestions. Thanks so much for taking the time to learn more about NeedyMeds, and we wish you good health and happy days. Thank you so much. Take care.